Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. Now, we got a special show today. Sarah couldn't make it. My fault. I had to change the show time, so I got a guest co-host today. This person's in medical and pharmaceutical sales, so we're going to talk about, do drug reps own doctors? And then, because for the first time ever, we have an all-guy crew, we're going to talk about some guy topics. Do men get plastic surgery? And what do men think about women in plastic surgery? And that's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me, not as always, is Mr. Robert Dressel.
What's up?
So
Happy
Robert
Friday.
is one of my best and oldest friends. We've known each other since college, and he is in medical and pharmaceutical sales.
True.
I thought that he would be a great addition to the crew today.
Absolutely.
And thank you for joining us. In the box, we got Travis.
Hey, yo.
And we have an all-guy crew today to talk about topics about women. How terrible is that? We're going to get canceled, I think.
Absolutely.
But that's why I picked some topics that, maybe are a little bit more, male-oriented.
Absolutely.
So,
I like it.
but yeah. So, Robert, you've done both medical and pharmaceutical sales?
Yeah, a little bit of variety. I've sold advertising, all kinds of good stuff. But pharmaceutical sales in the sense of going in and talking to doctors and write my drug and all of that stuff. So helped with some of the, insurance side of things, as well as hospice. So that was during COVID. Some tough stories.
That was pretty crazy.
Yeah, tough stories, but all good, learning, helping people.
Excellent. Well, I do appreciate you coming on. And so because you're here, I want to talk about a topic that you hear about in the news all the time, and that is just the huge influence that the pharmaceutical industry has on healthcare. And so this segment is about, do drug reps own doctors? And I have a lot of opinions about this. I'm gonna go over some just data that I have, and Robert, please chime in if you
Absolutely.
If I say anything that you think is accurate or inaccurate. So this is data from a few years ago. I couldn't find the most current data, but in 2016, the pharmaceutical industry spent $30 billion with a B dollars in the United States on marketing alone. And of that, $6 billion was for visits to doctor's offices. I assume that's salaries to pay people to go out and make their calls, right?
Right.
And then $13 billion was in samples.
Believable.
And then $1 billion was direct payments. And I think direct payments is, I would assume that's, and you might know this better than I, that's probably more like gifts, like lunches and stuff. That's not cash money, right? Or
So there's a variety of ways that they could have classified it. That was in 2013? 16. Okay, so I can't remember the years, but the Sunshine Act came out.
And we're going to talk about that.
Nice.
Yep.
And so what that direct payment is probably talking about is if you're a speaker, let's say you speak for
that makes
a shoe company because you love their shoes.
Right, then you get a stipend. Okay.
Yes.
Yeah. Okay,
and
that makes perfect sense.
You get paid to go to the training and that sort of thing. So that's more of the direct payments. But
Gotcha.
Yes.
So, and why this is important about the marketing, because some people might say, well, who cares how much drug companies market? Like, they're a private corporation. And I'm really kind of a free, capitalism kind of guy, so I'm going to kind of give my thoughts on that in a little bit. But the reason it's important is because far, far and away, the U.S. has the highest drug prices in the entire world by an enormous amount. And so this brings up some discussion of whether or not this is, a good or bad thing, right? Obviously, people at first glance say, well, that's bad. If the drugs are expensive, that means it costs more for the insurance, which drives up healthcare costs. It costs more for the patient. And so, that's one thing that is definitely negative about how much money is spent. But I always like to be devil's advocate and look at both sides of things. And so one of the good things about, the pharmaceutical industry having that much money is that the U.S. leads in discovery of new drugs by an enormous margin. I mean, a huge margin.
Yes.
In 1 year, and you can correct these facts. I looked these up, so these are from papers I read, but you probably know just as well or better. The U.S. creates 6 times as many new drug patents every year as the nearest second place country.
I believe
like
it.
They do almost half of all drug patents in the entire world.
I believe it.
And so that is one thing that, is a positive of these corporations having this much money is, if we didn't have these pharmaceutical companies creating these drugs, we might not have the next antibiotic for the next bacteria that becomes resistant. We might not have the next cancer drug. My mom has leukemia that 15 or 20 years ago would have killed her in 6 months.
Right.
But there's a new drug out now, and she takes the pill, and she has no side effects.
Wow.
And she's basically in complete remission, and she has been for, I think it's 5 or 6 years now.
Yeah.
So, these drugs do save people's lives in addition to making people's lives better.
Well, you took some of the words or some of the things I was going to say is
I stole your thunder?
you stole my thunder.
That's just like old times.
Absolutely. Anyway, so a big part of it is that it's like any company. Drug companies and all of that stuff, it's a very hot topic. And a lot of people are on this side or the other.
Yeah, right. And
but let's talk about ExxonMobil.
Okay.
So
Let's talk about it.
if they just go down the road and go, okay, we've got all this oil, then we're good and we'll produce it and sell it, but they have to go explore.
Right. And innovate.
Exactly.
Innovation, right? You need money for that. Right.
And that's what I compare it to is like, okay, they're going to hit some dry holes. Pharma's going to do the same.
They're going to lose money on certain things.
Absolutely, but it's different.
Right, and it is like there's two sides of the story because drug prices are stupid expensive, especially when they're under the 13.5-year patent.
Right.
Once they go into generics, then things do get cheaper.
And even speaking to that, so it's not just drug companies. There's so many things in between
like
with
medical
pharmacy.
device.
Well, with
Oh,
pharmacy
okay.
benefit managers and insurance companies, and there's so many things that it's like, oh, the drug companies get the bad hit because they're charging too much for this
Right,
drug.
there's middlemen.
Exactly.
Yeah, so everyone's taking a slice of the pie from
Bingo.
the factory or from creation to I get the
Exactly.
drugs from the pharmacy. Everybody is taking a little bit of a hit.
Yep.
So yeah, I definitely see both sides of that story. Obviously we want to make healthcare as affordable as possible because we want our citizens to be as healthy as possible. But there are some benefits to the drug companies having those bigger budgets, and you can see it clearly in the amount of new drugs that the United States makes. So, but not all doctors are as kind of neutral. I feel like I'm neutral. I don't necessarily love drug companies at all. I really feel kind of ambivalent to them.
Right.
Because I can see both sides of it. But not all doctors are like me. There are many doctors that are just very against the pharmaceutical industry and how much they have influence on doctors. And I had a study, Travis, I think it's just a still picture of that study. You can throw that up. Yeah. So this is a study from just a couple years ago from American Family Physician talking about how physicians should refuse pharmaceutical industry gifts. And it went on to say three points that I pulled out of this were, one, they said doctors should refuse to meet drug reps or medical reps,
Okay.
which I completely disagree with that. They should refuse gifts of any sort, which, I tell you, I'm going to talk about the old days. And nowadays times,
Right.
you don't really get very much. We get like Chipotle if we let someone
true.
come in the office.
It's true.
And it's nice because then my employees get a free lunch. It's
Absolutely.
not just me. I can get free lunch in the hospital.
Yep,
But my
good
employees
point.
get a free lunch, so it's a little bit incentive. So I'm not really against that either. And they also said that you should refuse all drug samples. Now, as a surgeon, I don't have. I shouldn't even say that. That's not true. I do have some samples, not necessarily drugs, but more for my wound care patients.
Like some creams and things like that?
I get samples and medications, and I tend to use those for people who who either don't have insurance
Absolutely.
or have problems buying them. So I actually really, really appreciate having samples. And the article went on to say, oh, well, people will say they give them to those without insurance. That's not true. I mean, it's been true for me everywhere I've ever been, as long as I've been in medicine, that we
Right.
use samples for mostly, not all the time, but mostly we use them for people who don't have insurance or that kind of coverage.
Absolutely, and I've always talked about samples as being kind of that gap. I used to sell a nose spray, and some people wouldn't want to go invest into it or buy it or whatever until they try it.
Right.
But as well, that patient is in your office in primary care or somewhere else, and they're suffering, and it may be diabetes or whatever. Well, after you send the script in, it's got to go through the insurance. The pharmacy has
Right,
to
it takes
fill
time. This is a stopgap.
So why not use that sample for that? And
I mean, I'm
insurance
all
or
for
no
it.
insurance,
Yeah, I'm all for it.
But I mean, to
Now-
consider it a bribe, no way.
I will say, I don't know, when did you start this industry? Because I know you didn't start
It's
right
about
up.
2013.
Okay, so
about 10, 12 years.
So I've been in this game since around
been a while.
2000. Yeah.
Yes.
Okay. So I know I'm ancient, but
Experienced.
So I will tell you that the 2000s and before was the wild. It was the Wild West.
I've heard great stories.
I mean, I as a resident got taken on a trip by one of the companies. Now it was
Absolutely.
for a conference, but they paid for my airfare, they paid for
Yep.
my hotel, they took us out to dinner every night. I mean, I'm a resident doctor. I'm nobody, but they saw as an investment in the future.
Absolutely.
I saw them, and they would also take people out and do like inappropriate things, take people to places that
I've heard
I mean,
stories.
just unbelievable things that I saw happen,
Yep.
in the 2000s. And I never saw like a lot of direct payment type stuff, but the amount of money that they spent was just almost obscene.
Absolutely.
And I do think that certainly could influence people. I mean, a little bit.
Yeah, you don't think it does, but at the end of the day,
When it was
it's-
that lavish.
It was.
Yeah,
I mean,
it was
and
crazy.
I never got to experience those things, I'll say.
Yep.
I mean, when I came in, the pharma code was signed. I couldn't give a doctor a pen.
Yeah, without documentation.
Yeah.
Right.
No, I couldn't. We didn't have them.
oh,
Like
they
when
wouldn't
I
give you-
started, which, like I say, I mean, 20 years ago, 25 years ago seems ancient, but yeah, I've heard stories about trips. I remember an attorney told us a story in training about if these doctors wrote this one HIV drug, then they would send them to this conference in Cannes, France.
Oh my gosh.
Well, that's how we got all the rules, but I agree with them.
Yeah.
So it's that whole I want to teach you about this drug, but I'm not trying to get in your pocket or your patients or anything like that.
Yeah.
So
Well, things changed obviously from the Wild West to today, and you mentioned it earlier,
Yep.
and that was the Physician Payment Sunshine Act that was 2010 that came through the Affordable Care Act.
yes,
And so that was a big thing that went through. I didn't really realize it at the time because I don't have quite as much interaction with reps as a lot of doctors who
Right.
have high volume practices. But this Sunshine Act of 2010 increased the transparencies of gifts made by pharmaceutical companies to docs, and this is a searchable thing. And it really kind of put a little bit of brakes on the lavish spending.
yes,
Which, I don't think that that's a bad thing. It was pretty crazy in the 2000s when I was doing it, and I'm sure it was even, crazier in the 80s and 90s.
absolutely.
But this did cause a significant decrease in the amount of spending. Well, a decrease in interactions with reps and doctors by about 14%, and also a decrease in samples and a decrease in spending.
Yeah.
So, my take on this, like everything, I like to see every side, and generally I'm a very kind of centrist person. I do think that probably the 80s and 90s drug pharmaceutical spending on docs was probably not a good thing because when they were spending that much money, they probably were influencing behavior.
Absolutely.
Do I think that happens today because someone brings me Chipotle? No, I just don't. I mean,
Yeah.
no one's going to influence me with that with something like that. I mean, I can get a free lunch anywhere. I pay for my own lunch.
Right.
So, you know, and maybe it's just because I'm in the specialty I am. Maybe there are people spending more money out there, but you don't hear about it, and so I don't think it's quite as prevalent. But on the other hand, I don't like what the article was talking about, you know, not letting doctors meet reps. I mean, I think that is a good thing.
I agree. So one of the things I always tried to do was their time is valuable. Your time is valuable. If you're a primary care or a family doctor, you're seeing, 30 patients, 40 patients. When do you have time to study new drugs and compare this one to that one? And the big one, cost.
Yep.
Docs would ask me, well, how is this covered? Well, that's a multi-layered issue, but letting them know how their patients can get it, but as well just, hey, these are the simple things.
Right. It just makes everything easier when you have a representative helping you through the process, like learning about it. And all good doctors should go back and check their work. And I do that all the time. When reps come to me, the first thing I always say is, show me the study.
Absolutely.
Show me. If you don't have a study, I'm not interested. If you have a study about your product, I'll at least look at it and see if it's something that might be applicable.
Yep. I had a doctor that didn't want to see any glossies. He told me no glossies because he had been on boards and he had
So
developed those.
tell people what glossies are.
So
I know what you're talking
glossy
about, but
is basically something you go in that has the study and it's very specific and it's this much better and it's this much faster
It's the
and
bullet
that sort
point,
of thing.
right?
It's the bullet point, but
Yeah.
it's all pretty. And it is good.
I don't want it to be pretty, darn it.
Exactly. And so he told me, he was like, no glossies, don't bring me a glossy. And I fully respected that. He's been an allergist for
He
years.
wants papers. Like paper. What did he want?
He just wanted the
Oh, to talk.
relationship
Oh,
to
I
talk
see. Okay,
a little
alright.
bit of that.
Yeah, very good.
So he gave me some pushback one day, and it was fine. It was more of a resource for him that was showing all the drugs in the category. We ended up being really good friends.
Yeah.
He took me down to his wine cellar below his office.
He had a
and
wine cellar below his office?
He made the wine below his office. He was like a chemist, really cool.
My gosh, I'm like lagging behind here.
Yeah, exactly.
Well, you did send me one clip when we were talking
Yeah.
about this yesterday. And so
Absolutely.
This is another kind of angle of the pharmaceutical spending that I think is worth at least talking about for a minute. And this is from the Joe Rogan show. So, Travis, can you roll that clip for
Big
us?
fan.
Well, here's the first problem. Advertising for pharmaceutical drugs on television.
Yeah.
Advertising for pharmaceutical drugs is illegal in every country in the world except for New Zealand and the United States.
Wow.
'Cause you shouldn't be able to influence people to want to take these drugs that they may or may not need. That should be entirely a conversation between you and your healthcare provider. Someone should be giving you an educated understanding of what the pros and cons are, and this is why I think you need this, and this is why you should take that.
Yeah.
It shouldn't be you coming to your doctor. Ask your doctor if la 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 is right for you. Do you have days or blah blah blah? Do you have that?
Yeah.
Well, la 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 is for you. But it's crazy. It's like everybody wants to be happy. So if the problem with advertising is, I mean, it's one thing if you're advertising for a nice pair of shoes or something like that. I don't find any problem with that.
Mm-hmm.
But when it comes to things like drugs, and especially when it comes to antidepressants, and when it comes to these things that they're advertising constantly on television, constantly on YouTube, just constantly, the amount of money is so extraordinary that they put into advertising. It's such a huge chunk of the advertising budgets of television shows.
It's every show.
Every show.
So, Joe Rogan talking about that he has a little bit of beef with the fact that pharmaceutical companies can advertise on TV. So, I'll just go ahead and give my opinion on that. I disagree with him a little bit. Like I said, I'm kind of a free capitalism kind of guy. If they want to advertise, let them advertise. I think that his fear that someone's going to go to a doctor's office and get put on this drug just because they asked for it is probably unfounded. It may get the person to inquire about it to their doctor, but doctors, at least all the doctors that I have historically worked with, have a pretty strict regimen for how they prescribe drugs.
Absolutely.
And
Absolutely.
so I don't think it's a bad thing though, because it does get people thinking about their health care. And when someone sees an ad on TV for, a certain drug, that might stimulate them to go to their doctors, which
Right.
we're always trying to get people to go to their doctors. That's
True.
one of the reasons that some of our metrics are not as good as other countries is because we're not great about going to the doctor.
True.
Americans are independent. We're stubborn. We think, we know it all. I mean, and we don't go to the doctor. But, I think that has the potential to get people into their doctors, at least start a conversation about
Yep.
whatever issue that they've seen on the TV. And I just don't feel, I'll tell you, and granted, I'm not a primary care doctor, but
Right.
0 times in the 20 years I've been practicing medicine has someone come into me and said, hey, I saw this ad on TV for this drug, will you give it to me? And granted, I don't prescribe a ton of drugs, but there are other products, medical things that
Right.
are advertised,
Right.
So I don't know. What are your thoughts on that?
So supposedly it does happen a lot.
Really? Okay. Everything I said is wrong.
No,
Sorry.
no. But I think it just depends. I'm with you on the free market.
Yeah.
There's one other country in the world that allows it.
New Zealand.
Boom, winner.
I only know that because I watched
And I
the-
love Rogan. I wish Rogan would hear this.
Rogan's
and
coming on
comment.
next week.
No, he's
not.
not.
Rogan.
I wish he would. That'd be awesome.
That would be
I'd be
fun.
here. I'm a big fan.
Are you?
Yeah.
I don't know if I've ever watched one of his episodes. Is it
he-
really good? Do I need to watch it?
Yeah, man, he's got all kinds of good people on, but he's fair and he'll listen.
Yeah, he's
but
pretty
he'll do
balanced.
his research.
Oh, that's good.
and so
He's like us.
exactly, you know what you're talking about. But yeah, I think it's good. The key is a patient having those right expectations, kind of what you've talked about with plastic surgery. Like, not really going to get that, but this
Yeah.
is what you can expect.
Well, and that's where the doctor needs to come in and
Absolutely.
do their job, which is say, okay, this drug is appropriate for you for these reasons, or it's not appropriate for these reasons. And I feel like most doctors do that. I don't think there's a...
Do you have a lot of patients come in with their list or WebMD? I guess it's different.
Oh, dude,
but
yes. Like with questions?
Yeah.
Yes. I mean, I do very frequently, and I love that. I've talked about this many times that I really almost insist on my patients being informed.
Yeah.
And so when I'm talking about surgeries, like I inform them, but I love when they kind of pre-inform themselves.
Absolutely.
And I always ask, okay, did we cover all the things that you brought? And usually, because I've done these consults 100 million times,
Right.
they're like, yeah, you answered all my questions. Or sometimes they'll come up with a new question. I'm like, oh, that's a
Yeah,
good one. So
that's a good one.
so, Travis, weigh in on the. I mean, this is probably not in your wheelhouse, but any thoughts? You've been kind of quiet in there. I'm going to really hit you up for the next 2 segments, so I hope you're ready.
Absolutely.
But I mean, what do you think? Like, I don't know. Any thoughts on the pharmaceutical industry?
You know what's funny?
Not a fair question for you.
I've never personally walked into a doctor's office that I've had and requested a certain medicine that I see on TV. Most times, I'm not going to lie, whenever I see a medicine on TV, it kind of makes me not want that medicine. For
Really?
whatever reason. I don't know why.
It's because if they have to advertise for it, it probably sucks, right?
And I think they tell you like all the side effects and stuff like that on the commercial.
If you
up
take
front.
this, your head might fall off. You'll
Right.
get herpes,
Is it
rabies.
Is it that
implodes.
bathtub in the middle of the nowhere thing that kind of scares you? The Cialis?
be.
Like, wait a minute.
Not
Nobody takes a
Cialis.
bath like that. What's up?
We went straight to Cialis. This turned left.
It's so funny because like they show these commercials and the people are all like having the best time of their life,
Right.
like,
Exactly.
like
And-
out in the field flying a
Yeah.
kite, and you're just like,
Thanks.
I ain't doing that. I mean, will I
Right.
do that if I take this drug? Maybe I do need it. I don't know.
That's what Rogan was talking about too. It's
Exactly.
like this. I mean, really?
Yeah, I don't
so-
know.
Right.
I don't. I just tune out when I see a drug commercial. I'm just like my brain just shuts off, and
Right. Facts.
I feel like it's almost like work. So I don't want to like have to think about drugs when I'm at home. Like, man, it's just like a
Right.
work thing. So
Interesting conversation though.
yeah, it is. So all right, guys, listen. If you're out there, let me know what you think about. Does the pharmaceutical industry have too much power in the United States? Do they spend too much money? I mean, there are definitely pros and cons. It does drive up the price of drugs, which drives up the price of healthcare. But as I said, it does lead to a lot of industry. It leads to a lot of innovation and new drugs, which I mean, for me, have saved my mom's life. So, and I'm not just saying all these things because of that, but I mean it is a true fact. So, let me know what you think about the pharmaceutical industry. Sometimes they're bad guys, sometimes they're heroes. Here, we're just talking honestly about it.
Absolutely.
Just having an honest
Be
chat.
real.
Be Real. Are you on Be Real?
No, I'm not.
Do you guys know what Be Real is?
Yes, I know.
Travis, do you know what Be Real is?
I know a rapper named Be Real from back in the day, but that's about it.
No, like
Nice.
the app Be Real. Do you know
Oh,
what
I
it is?
know.
no, I
So
do not.
yes.
Are you
My-
on Be Real?
No, my niece and nephew do it. It
I'm on
pops
it.
up automatically.
Yeah,
you take a picture of yourself and then where you are.
Yep, but you
and
have
it
2
has
minutes to
go.
do it.
Yeah.
That's it. Yeah,
And
my daughter Danica got me on it, and I really enjoy it. And it's funny because I'm on Be Real. Hit me up if you're on Be Real. I'll be your friend out there. I'm on Be Real, and like 90% of my friends are my daughter's friends. And I have 2 real friends. That's it. There's an anesthesiologist I know that has it,
Nice.
and one of the scrub techs.
Nice.
And so I need more adult friends on Be Real.
Absolutely.
So if you feel like Be Real, hit me up. I can't remember my name. I think it's Bruce Hermann or something, or BF Hermann. I can't remember. All right, moving on. We're going to talk about some guy stuff because this is a one-time
Bring it
only
on.
that we've had an all-guy crew, which I feel is probably terrible since we talk about a lot of women's stuff, Sarah. We
no.
miss you, but no offense, Robert.
yeah, I get it.
No, but I thought we could talk about some more, men-oriented topics about plastic surgery. And the first one, which is the obvious one, is do men get plastic surgery? So, I'm going to throw out some data here. We're going to unpack all this. When we talk about these plastic surgery topics and we have these segments, it's almost always about women. It's almost always about
Good
women.
point.
And it's not necessarily true that women completely dominate the plastic surgery and aesthetic market. Now, they do kind of dominate it. So if you take everyone out there getting surgery, aesthetic procedures, it is 90%
Wow.
women, 10% men as of the latest data. And I guess, the first question, well, and second too, that number is shifting. I mean, it's getting bigger on the men's side,
Right.
but it is absolutely dominated by women right now as the primary consumers of plastic surgery and aesthetic treatments. And, I guess one of the questions would be, why is that? I think some of the answers are obvious. I mean, societal
Yeah.
pressure on women, I think, is
Right.
much higher completely unfair, but seems like societal pressure on women to have this, appearance
Absolutely.
is very high versus, men don't get that as much.
No.
I mean, we just don't. I mean, and I feel like I like to try to care of myself, and I'm very kind of, into, putting my best presentation forward. But I don't get the pressure that women do.
No, I feel it too. I don't feel the pressure, but I think men, sometimes we don't care.
We just don't care how we look, women. Sorry.
It's true though. If you go out and look at some guys, you're like,
Yeah.
man, does he
Yeah.
have a mirror at all?
Yeah.
But it's kind of like going to the doctor. Who's the last one to go to the doctor? Men.
Yeah, man. We're just
I'm
terrible on
fine.
offense.
I'm fine.
Yeah,
we
I'm
push
fine.
through it, and it's all good.
And I think another obvious answer of why women are more into the aesthetic market is pregnancy.
Yeah.
I will tell you that of the patients I do surgery on, the overwhelming majority are women who are kind of done having kids. That is the classic patient that I see.
Yeah, makes sense.
Because pregnancy, and I feel bad for women on this, pregnancy does a lot of things to your body that you can't fix on your own.
Yeah.
If you gain a little bit of weight, that's one thing. But like if your skin gets stretched out, your breast gets stretched out, your abdomen, your abdominal wall, there's nothing you can do about that.
Absolutely.
And so I think that women really kind of got the shaft on that one because, for us, we don't have to go through that.
Right.
And that's not the entire reason. I think the societal pressure is a big one. I think that those two are probably the biggest. But yeah, the percentage of men getting procedures is going up. And if you look at it now versus in 2000, so a little over 20 years, there has been a 30% increase. So that means, I guess, in 2000 it was probably 7% men, and now it's 10%. So we have seen a pretty significant jump in that. And every year it is going up just a little bit with men getting more and more stuff.
What do most men get?
We're going to dive into that, man. You were right on top of it. But I wanted to ask a question. And you guys don't have to answer this if you don't want. I'm going to answer.
I'm not
I'm going
afraid.
to answer honestly. If I told you that you could go and have any surgery or procedure you wanted for free, and you had a 100% guarantee that it was going to go perfectly, and you're going to get a perfect outcome, would you have anything done?
So Magic Genie.
It's a,
rub the
we'll
lamp,
say
he
it's
comes out. and grants us the wish, right?
Yeah, but it's a procedure, right? The genie's
Okay.
doing the surgery or doing the procedure or whatever it is. So
Okay.
it's not like he's waving a wand. Like you have to go have surgery or procedure.
Right.
Like you actually have to have,
You
but,
have to-
but you have a guarantee. One, it's free,
Ooh.
so you don't have to worry about cost. And
Right.
two, you're guaranteed to get fantastic results. Would you guys have anything done? And do you want me to go first or last?
You can go first if you want.
I'll go first. Okay.
Yeah.
So, I mean, I am kind of vain. I mean, anyone who knows me will say that. I do like to take care of myself. I mean, look, do you think this is natural? I mean, come on.
100%.
I mean, come on. And so, one thing I would do, I mean, I do take care of myself, so there's a lot of things I probably don't need because I'm a runner and I do that.
Right.
But I've always thought that maybe I could do like a little bit more on my jaw. I don't have like a super strong jaw. It's not terrible,
Okay.
and I'm not like super self-conscious about it, but
Right.
but I have noticed it in like, I like the people that have that Bradley Cooper jaw,
Okay, yeah,
Johnny
yeah.
Depp, like
Very-
that
yeah.
looks good, man.
Yeah.
I wish I had that. And
Yeah.
honestly, those surgeries are not really super invasive because most of the
Right.
time it's done with little implants. So that's what I would do. I mean,
Okay, I like that
now
one.
if you don't have anything or you want to answer, you don't
Travis
have
is
to.
like, I'm going last. I'm going last. If
No,
I'm
I'll
going
go
at
next
all.
if you want. I don't mind.
Go for it. Go
Are you-
for it.
So if I could get any surgery and I knew it was gonna be perfectly fine, it would probably be lipo.
Lipo, okay.
Yeah, it probably would be.
And we're
lipo.
going to talk about that for men because actually there's something about that makes that a little more interesting.
Oh, really?
There is. Yeah.
Okay.
Yeah.
Yeah, for sure. It'll probably be lipo. Like I'm a proud big boy. I love being a big boy. But for health reasons, I would probably want to be smaller, faster,
Yeah.
in like a shorter
little
amount of time.
sleek.
Absolutely. Yeah, absolutely.
All right.
It's
Well,
the
I
case.
appreciate the honest answer.
Yes, indeed.
Robert?
Yeah, so I'm kind of in the same realm because I can
Okay.
go up and down in weight.
Okay.
I don't have that wonderful genetics. I'll blame it on that. I mean, it's not me eating Bluebell. It's not that at all.
It's not the ice cream
It's
and the
not
pizza I eat.
bourbon
It's not
at
the beer.
all.
No.
So yeah,
Okay.
just like that
All right.
more healthy, something like that.
I
for
appreciate
that
you guys
long-term
giving an
being
honest
around.
answer,
Absolutely.
being real. I appreciate that. All right, so we are going to talk about the most I'm going to start. So I'm going to break this into two categories: the most
Okay.
popular surgeries for men, and this alters a little bit each year. So I mean, I can't remember what year I pulled this from. It was recent, but they may be off one or two. But I want to go through them. All right, so what do you? I hate putting you guys on the spot, but it's always kind of fun. What do you guys think the number one surgery? Cosmetic surgery, not like Botox, but
Yeah.
cosmetic surgery. that-
Botox, right?
Yeah, we were going to talk about Botox. Oh, man, I had a picture I was going to bring, and I forgot to bring it. Oh, remind me, Travis, next week I'm going to show this, even though it'll be a new show.
Okay.
There's a picture I want to show because somebody sent me the most amazing male Botox before and after, and I meant to upload it, and I totally forgot. Because
All
it
good.
was really good. I looked at it, I was like, I'm going to get Botox.
Oh, God.
All right, but anyway, all right, what do you guys think the most popular surgery for men is? Number one. It's number one by a pretty big margin.
Yeah, that's a tough one. I mean,
You've
got calf implants. You've got
What about like ab surgery or something?
abs. I mean, does anything in that
Li-
midsection? That's what I was gonna say. The nose.
Yeah, rhinoplasty.
The nose,
Yeah,
yep.
rhinoplasty is number one.
Okay.
So rhinoplasty is number one. That makes up almost a quarter of all plastic surgery for men. Almost. It's like 22%. Second is blepharoplasty, eyelids. That's something I do fairly commonly on men, actually. I literally just did a blepharoplasty on a guy last week. So that's really common. Now, I will say that men mostly do it for functional reasons.
Interesting.
Because as the eyelid skin gets too much, it starts to obscure your vision, but it's still considered a plastic surgery. So rhinoplasty, blepharoplasty. Number three, I didn't believe. Number three, they said was cheek implants, which maybe that's jaw implants like I was talking about.
Well, just I,
I mean,
guess
cheek
defining.
cheek to me is up here.
Yeah.
Maybe they meant facial implants because I just find it hard. And this was from the Society of Aesthetic Surgery, so this is like a pretty good list that I got.
Yeah.
It said cheek implants. I really feel like they meant facial implants because that would include everything.
Right.
And that would make more sense. I really was scratching my head on that one. So number 4 was liposuction. Now, I want to tell you guys, because I'm a breast and body specialist, so I do tons of lipo. There is a problem with male liposuction, and this is something that most people have no idea about. So I'm about to drop some truth bombs on you guys,
Uh-oh.
and I'm gonna,
Okay.
I may like bust your bubble here if you guys will run out to get this free surgery I've been offering you. So women tend to collect fat externally. And what I mean by external is they collect it external to the muscle layer. So that means like, hips, the tummy, okay?
Right.
But it's external to the muscles that separate your insides from your outside.
So basically, it's just under the skin.
Yes, that's correct.
Okay.
Men are much, much more likely to get intra-abdominal fat. The beer belly guy typically will have a pretty normal fat layer on the outside, and they have a lot of fat in their viscera, their omentum.
Yep.
And I've had many men come to my office asking for a liposuction consult, and I go and I examine them like, look, I mean, you may have a tiny bit on the outside, but like this belly is not necessarily, I can't get to it. Because if it's internal fat, you can't lipo that. I mean, you'd be poking holes in your bowel.
Right.
And now that's not always the case. And I've seen women who have a little bit of extra girth, and it was from intra-abdominal fat.
Interesting.
And then I've seen some men who do collect it more externally.
Yeah.
I think it's a hormonal thing. I really need to dive into why that's a thing, but I have found that to be true the overwhelming majority of the time. So
Wow.
it's a little bit harder to do lipo on men because a lot of times you can't get to where
You
the
need
weight
to go.
is. Yeah.
Yeah.
So that's one thing. All right, moving on. Otoplasty or ear molding, and a lot of that's done on kids. I mean, they do sometimes on adults. So, but the last one is one I do literally all the time, and probably the most common surgery I do on men, and that's gynecomastia, the man boobs.
You know what's
Moves.
funny? So Cindy Hermann is watching. And,
Hi,
and
Cindy.
I didn't know how to pronounce it, but I was going to give it a try, but you beat me to it.
Oh, gynecomastia?
She did say surgery for gynecomastia.
Yep.
And also the little Herman is watching as well.
Oh, Danica?
She
Danica's
says,
probably
"Hi,
really
Dad."
sad that I didn't invite her to come to co-host.
She
Sorry,
says her and her
Danica,
friends
next
are
time.
watching.
Next time.
So gynecomastia for me is super popular. It is a super, super common problem. A lot of men have this, and either they just don't care or they hide it.
Right.
But so for those who don't know, gynecomastia is when men get either the nodular part behind the nipple areola that's more like what women have, or the breast mound itself where they look like they have a female breast, or they can get both. And the cool thing about this is it is a easily correctable surgery. I think the satisfaction rate for the gynecomastia surgeries I've done in my career is, I think, 100%.
Nice.
It is very easy to fix. The recovery is very simple. And the only downside is it is very, very tough. Not quite impossible, but very hard to get insurance to cover it. A couple of
makes
insurances will still do it. TRICARE, which is the military insurance, still does
that's
it.
good.
I know for a fact because I've seen plenty of service people for it.
Right.
But yeah, so gynecomastia.
On a lighter note, a buddy of mine used to try to work out his chest more. So his chest would be bigger, so his belly didn't look so big.
Oh, dude,
There you go.
we talk about that all the time when we do consults for mommy makeovers, which is breast surgery plus
Yep.
tummy tuck. Because people will be like, "Oh, I want to get these really big implants." Like, we have to remember, like, when we do the tummy tuck, this is all going to be a lot smaller, so it's
Right.
going to make this look bigger, and you have to kind of counsel people on that
Yeah.
because it does make a difference. Yeah,
Right.
the biggest tree in the forest looks big or something. I can't
Exactly,
remember. There's something
exactly.
to say
Yep.
about that. All right, so most popular non-surgery treatments. Robert, what's the number one most popular non-surgery aesthetic treatment for men?
Botox.
Botox. My nurse is really hounding me to do Botox. I'm very kind of blessed. I don't have a lot of wrinkles, but I'm just starting. Look, you can kind of see them. If you look, see it right there. Now, when I don't do that, they're pretty much gone, but you can almost see them. So I may try it. There is one thing with doing Botox on men, and this is a good thing to know.
Hold on. What would she say about me? I'm like,
Yeah, you could use it. You could
we
use
all
it.
could use it.
Everyone could use Botox.
Absolutely.
I make almost $0 on Botox. I'm not lying. The margins on Botox are super thin. But I'm telling you, Botox is one of the best things for staying young. And it's like cigarettes, man. That stuff sells itself. Like, you give somebody this stuff, and they're going to come back.
Right.
I just wish you made some money on it, because we don't make very much money on Botox. But it does get people into the office, and it makes people happy, and it looks good. So,
Yeah, absolutely.
Botox, the problem with men. So it is very common with a standard injection pattern of Botox to get an arched eyebrow, okay? And women like it. Women manicure their eyebrows commonly to be
Absolutely.
arched, but men do not like it. And so if you are a man and you're going to go out there and you're going to get Botox, you need to make sure that your injector knows about that, because the quality of injectors is all over the map. There's people that are phenomenal, and there's people that I wouldn't give my dog Botox.
Right.
And so you just need to make sure if you're a guy going out there that they understand if they're going to do your forehead that you don't want an arched eyebrow look as a man. Typically, I mean, if you want that, go for it. I'm just saying in general, it's not like a good look for a dude.
Right.
In my opinion, I mean, I don't mean that. Maybe some people like it. I don't know. Okay. The next most popular non-surgery is something I love and I do every year, and that's laser resurfacing. I love my laser machine. I talk about it all the time. I'm due to get it. I can't wait. I mean, it tightens up my skin. I swear I look 5 years younger after I do it.
On the face? Or?
Yeah, face and neck. Do your face and neck. It resurfaces everything. Like, people always comment on my skin after I get it. It's basically, I mean, it's not painless, but pretty much.
Like it doesn't hurt, really?
I mean, you put numbing cream on, and your face burns a little bit. There's a little bit of downtime.
It is a laser.
It's a laser. I actually carved up a pumpkin with our laser one Halloween.
That's awesome.
So I really like laser hair resurfacing. Number 3, laser hair removal. I will admit I've done that before. I'm going to probably give you guys TMI right now. No, not that. That's not a manscaping thing.
Gotcha.
I saw,
no
but no,
pictures.
I don't like chest hair.
Okay.
I just don't like chest hair. And I don't know why, but I mean, I don't mind hair everywhere else, but like I used to shave my chest, and then I did
On
laser.
yourself or on others?
On myself.
Oh,
myself.
sorry.
I don't care what you do, man. As long as your chest hair isn't reaching out and grabbing me. Like,
Right.
So I did laser hair removal on my chest, and I really
Nice.
liked it. The only thing is, you do have to. I did it probably 10 years ago, and I probably need to repeat it. But I mean, it lasted a long time, so I like laser hair removal.
I think we should have a skit or something, and you can do it on Travis and I and see how it works.
Laser hair removal.
Yeah. What do you think, Travis? You in?
that a good-
Does
that's
laser hair removal
guy we
hurt?
No, it
No?
doesn't. No, the light is warm.
Okay.
It's warm.
Okay.
But I mean, we do like women's,
Area.
areas,
You're right,
yeah, right,
right.
and they do fine. So,
Okay,
and we don't have to
for
numb it
sure.
up. Like, you use a little cooling gel, and it's like, yeah, that's kind of warm, but it's not
Right.
too bad. So,
Okay, got you.
Yeah.
I would try it. I don't mind hair, whether it be on my chest or whatever, but or like arms and all of that. So I don't really mind hair, but I would try it.
yeah.
I would
Dude,
try it.
if you want it, I'll come in. I'll give it to you for free, man. It doesn't cost a lot to use it. So, okay, soft tissue fillers would be number 4. So that's like the fillers that women get, which I found that one surprising. That's
Like
not
the lips and stuff?
could be anywhere. Lips, nasolabial fold. I could see some guys doing the nasolabial folds,
Right.
because it does make you look younger. Lastly is microdermabrasion, which is just skin treatments. So anyway, I want to talk about the ones. I have 2 more things to talk about on this topic. One, what do I think are some of the best surgeries for men? I already said one. I think gynecomastia surgery is great. I mean, I guess because I do a lot of it, and I'm not saying that to drum up business. I just think they're cool surgeries. You can take something that a man feels super self-conscious about, which is having man boobs, and you can make that go away.
I bet the feedback you get is amazing.
it's good, yeah.
And so that's awesome.
I think eyelids are great for men. It's functional. It's cosmetic. It's pretty simple surgery.
Right.
Rhinoplasty obviously is a big one. I mean, for those people who want to have a better nose, rhinoplasty is great. Just make sure you go somebody who does a lot of rhinoplasties. I don't do them anymore. I just kind of got into my niche. I do think Botox is good. I'm kicking myself because I had a great photo. I'm going to show it next week. Make sure you tune in. I want you to see it.
Absolutely.
'Cause I'm going to have you moms get
I'm
Botox. And then I love the laser skin resurfacing and the skin tightening stuff.
Yeah.
I mean, because it's not very invasive. It gives good results. It's not super expensive. And so I want to do, the final thing is there a good reason for men to have these procedures? I can think of 2. I mean, what do you guys think? I mean, I guess you probably don't have any problem with men doing stuff, right? I mean, you don't think it's girly? Would you think less of me if I went and got plastic surgery?
No, you do you. I mean,
That's how I feel too.
You know?
I'm just like, if you want to have plastic surgery, man, go get it.
yeah, absolutely.
But I have 2 reasons that are actually good reasons why men might consider it. And I'm not saying this to try and have people come out. So I'm just trying to look at all
Right.
factors. One, there is a lot of research out there about the fact that people's self-image and body image do go up, and their self-confidence, which affects a lot of factors in their life, when they do a procedure and they get the outcome they want.
Absolutely.
That has been well documented in the literature. It can make a difference. I don't feel like you should go out and get something thinking that, this is going to change my life. That's
Right.
the wrong way to go about it. But if you're like, hey, this one thing, my man boobs bother me, or I want these jaw implants, and you
Exactly.
go do it, typically you're going to feel better about it. Like there's a very high possibility. The second one is ageism in the workplace. That is a real thing, people. Like there was a
Absolutely.
huge lawsuit against Google because they were pushing out men that were older, and these guys won a big lawsuit. And there's a ton of research to show that people who look younger either retain their jobs more, get more promotions, or just do better in general in business. And so, you know, I mean, someone my age, if I was fortunately can't fire myself, but if I was in the corporate world, I mean, I might think about it more seriously because it does make a difference. So
Yeah, absolutely. I mean, we all say, oh, looks don't matter and this and that, but when you look at yourself and you have a little bit more confidence and you're happier, you're like, oh man, that looks good, you know, or whatnot, then yeah, absolutely. That's going to boost your ego. And
all right, I want to do some quick recap of this segment. This is a quick recap on our segment about do men get plastic surgery? And the answer is yes, they do, but not quite as much as women. It's about 90% women, 10% men in plastic surgery and aesthetic treatments, although men are increasing each year as more men find that they might want to go under the knife or get some treatment. Some of those popular things men do are rhinoplasty, eyelids, sometimes liposuction, Botox, laser treatments. I think a lot of these are good. However, there are sometimes some certain things about those treatments that specific to men need to be addressed, such as Botox and how it might arch your eyebrows, or liposuction and is it internal fat versus external. So I think there are some good reasons that men might consider plastic surgery. One is there's a lot of studies that show that it increases their body positivity, their overall self-confidence, which does weigh into other areas, and also that ageism in the workforce is a real thing, and looking younger always has been shown in studies to make you more successful at work as well. So if you want to learn more about that, watch the whole segment that we did on do men have plastic surgery. So cool. All right.
nice.
One last segment, and we'll kind of go through this with quick one because we've been really digging into these, man.
I like it.
This has been good. So we might get in trouble on this one. So just we got to tread carefully here, gentlemen, because we're treading in dangerous waters. But I want to do a little segment on men's views on women having plastic surgery, because I think we see that a lot out on social media, that women are very open now about plastic surgery, which I do think is a good thing, and it generates a lot of opinions. If you go into the comments on somebody talking about plastic surgery, you will see both positive and negative things.
True.
And but I'm going to start out this segment, I'm going to say one thing, is that if you're a woman thinking about plastic surgery, the only person's opinion that matters is your own. You absolutely 100% should not do any type of treatment based on the influence of anyone else, especially some dude. So I just want to say that what we're about to do is just kind of informative and for fun, but don't take us seriously because obviously we're all knuckleheads here. So.
Absolutely.
True.
So,
true.
okay. First off, what does the research show about this? Well, I did pull a study. I'm going to throw up the study, a picture of it, Travis. This is Under the Knife, Unfavorable Perceptions of Women Who Seek Plastic Surgery. This is a pretty recent study that was looking at people's, and specifically men, they broke it down, men's opinion on women who were seeking plastic surgery. And this study just kind of made me angry, if I'm going to be super honest, because the general gist of this article says that men do look down on women who are thinking about having plastic surgery, which kind of blows my mind, because if you took the befores and afters of these women, I bet most men would say that the afters look better, right? If they're done tastefully. Obviously, there's bad plastic surgery out there. Sometimes there's bad decision making, and
True.
people get stuff that maybe doesn't look good to most people or other people. But I don't know, that article just kind of annoyed me because, one, I mean, I guess if you're asking someone directly what their thoughts are, I don't think men should ever necessarily tell a woman they need a plastic surgery. That sounds like a terrible idea.
Yeah, that's
but
a bad idea.
But to say that they look down on somebody because they're thinking about having a procedure to help their self-image, I don't know. I think that's kind of low. What do you guys think?
Yeah, absolutely. I agree with you, and I'm with you on the same thing. Like, don't do it to make somebody else happy because you're not. I mean, you're not going to. It's
right.
Yeah, I mean,
that person
at
is not
some
like
point,
your friend if like they're out there trying to
absolutely.
get you to have something.
Yeah,
done.
no, and yeah, hey, honey, you need to go. Let's work
Dude,
out together.
So I will tell you, I have times in my office when a woman will come in for consult, and then the guy will start speaking up about what she needs to have done, and that annoys me to death. And
Mm,
I will
bet.
kind of like stop and say, I will say to the woman, which might potentially run off the customer, and be
all
like,
right.
listen, this is your decision. That's we can give you input or ideas, but like you need to make the decision on your own. Like this is for you, no one else. And
Yep.
I get kind of nervous whenever I see husbands kind of being domineering like that. It just makes me kind of
Yeah, I think it's like, I mean, this is maybe a bad comparison, but with men, having the big trucks and this and that, it's like they're trying to hide something. So maybe having those men that do that in your office are trying to say, oh, look at me, because it makes them look better and feel good
Yeah.
about, having this sort of look in a wife or spouse or
Yeah.
girlfriend or whatever. But
Well,
yeah.
I did find it interesting that there in more than one article says that people kind of look down on women who are seeking plastic surgery. I obviously as a plastic surgeon don't share that. I mean, we just in the last second talked about what we might do if we wanted to have plastic surgery. So, but what I was going to do is I wanted to go through and ask you guys as men, just like what you thought about some procedures, and I mean, I can weigh in, but I've done that a million times, and I mean, I will weigh in, but I mean, my first thought on people having plastic surgery is if you want to go have surgery, if you want plastic surgery, do it. I mean, be safe, do your research, don't do anything dumb, but like, do it for yourself if that's what you want to do. I mean, I feel like that about a lot of things in life that hey,
Yeah.
if you're not hurting anyone else, I mean, do what you want to do.
Right. At the end of the day, if you want to go after this career or that career, it's kind of on you. How's it going to affect the family or this or that? But ultimately, yeah, you got to live with it. And so
Do what makes you happy?
I don't exactly.
Yeah.
I mean, to a point, I think you can look at it and go, well, she's not happy and she thinks this surgery is going to make her happy and it's not and this and that. And it's maybe those things are true, but at the end of the day, if it's a confidence booster,
Yeah.
if it's something that's always been a problem or they've been teased about, like a
Right.
nose or, small breast or big breast or whatever, you don't know what's going on with them. And so let them do it. I
Yeah,
mean,
don't judge them.
Yeah, exactly.
Well, I want to ask you guys about specific procedures because I know both you guys are out there in the dating world, right? So you probably like see this stuff like out in the wild. I haven't been out of the dating scene for like
Out in
a
the
century.
Out in the wild, right. Yeah.
So-
you're oblivious. You're like, what?
Yeah, no, I got the blinders on, right? I'm walking around.
Yep,
All right.
yep.
So what do you think about girls and Botox? Do you have any opinions? I mean, and I'm not asking making a medical opinion or anything. Like, just what do you think? Did you think it's good, bad, both, indifferent?
Travis, you first.
Oh, Travis going first? All right. Travis, do you even notice? I mean, and I bet you probably do after being on the show now for 2 years.
Right.
You probably notice these things. So what do you think? Like,
So I do notice it more for sure. I would say like girls with Botox. I don't mind it. Like I really don't mind it if it's done like in moderation.
Okay.
That's probably the only thing I
I
would say.
feel like that's going to be a recurrent theme in the things we talk about.
Yeah, for sure. Now, if you ask me to pick a side, like black and white, if you ask me to just pick a side, I would lean towards the side of not having it.
Okay.
Just because I do like more of a natural look. I think we are all like gonna like age eventually. You know what I'm saying? And maybe this is my man mentality.
Sure. Man,
but
dude, I like the honesty, man. That's
right.
totally cool.
We
Oh,
are
well,
all
and
gonna age.
and I'm speaking about myself now, not about women, but
Right.
that's how I've kind of felt about Botox. So that now that I'm starting to get some wrinkles, I'm thinking about changing my mind.
Sure.
It's like, but I had that opinion too. It's like, well, I'm just gonna get wrinkles, like
Right. It's just gonna happen. It's one of them things. Like I'm gonna love you with your wrinkles, and I hope you love me with my wrinkles.
Absolutely.
That's so sweet. All right, Robert,
Absolutely.
Botox.
I mean, I hate to say it, I'm very similar. I think for me, over the line is when it's really obvious or
Yeah.
the really puffy lips or
Yeah.
it's just not my style.
Yeah.
Right.
You do you, boo, as they say, but it's just not, I mean, and I don't, at the end of the day, I don't care. How are
Yeah.
you going to treat me
Yeah.
and how are you going to treat
Yeah.
others?
Well, and I say this literally all the time on the show. If there's like a tagline for the show, this should be it, is that the best plastic surgery or aesthetic treatment, but the best plastic surgery is the plastic surgery that no one knows you've had.
Absolutely.
They think that you look
Facts.
good,
Yes, facts.
but like they don't know that you've had it. And so I think that Botox, like the next one is fillers. I mean, you could say the same thing about fillers. I've done fillers on people that look amazing, and if I lined up 10 people and asked them if that person had fillers, they would say no. They'd
Right.
say that person just looks good,
Right.
right? And I think that, when you talk about Botox, you talk about fillers, I personally like them. I do. I mean, I think a lot of people can really benefit from them, but I think that there's just such a fine line between what's right and then too much. And
True.
I think a lot of people go past that, and I think that that's why there's maybe some negative connotations with Botox and fillers.
Where do most fillers go? I know lips.
I mean, it
where
could go.
else?
So the most common areas are lips, nasolabial folds, which is right here, because as we
Okay.
age, our face does like
Right,
this,
right.
and then you can soften those up with a little bit of fillers. Marionette lines here. That
Okay.
would be the most. And then there's cheek fillers too that are pretty
Yeah,
good,
yeah,
because
yeah.
as we age, our mid face starts to hollow out, and so the cheek fillers will restore that. Once again, you can restore it to where it looks normal, or you can go overboard and look like. Who is the girl that we had on? Oh, Erin Moriarty. Remember that, Travis, the girl from the Boys or whatever?
Oh,
she
yeah,
had like
yeah.
the huge cheeks. And we're like, oh my God, did someone punch her?
Right.
Right.
But yeah, I think a good amount's good, too much bad. What about breast augmentation, guys? You like that? I mean, is it kind of the same thing where if it's tasteful, you like it, and if it's too much, you don't? Or
I mean, I'll jump in. Same thing. I mean, I don't know what you went through with kids and
Right.
how many and all of that stuff. And at the end of the day, could have been a cancer thing or
Yeah,
whatever.
could be
And
reconstruction,
so,
yeah.
who cares?
yeah,
At the end of the day, but yeah, being out in the wild and dating, and you see a variety.
I bet you see it out there. Everyone, their grandmother has a breast augmentation in Dallas, Texas, I think.
For sure.
Yeah.
I will say that though. I guess with like the plastic surgery, I'm more lenient, I guess, on that. Because at the end of the day, like, it's her body. If she wants
Yeah.
to do that, if she feels that she needs it, then of course I'll support it 100%.
Nice.
But I would, yeah, of course, I would more so be inclined to having that done if she sees it fit than anything else.
Yeah.
For
All right. I think we're probably going to end up saying the same on all of these. I've just listed some procedures out, like I had lipo and all that. But I'm going to ask you about one that might get some different answers, and that's Brazilian butt lift.
I knew that was coming.
You knew it was coming. I wouldn't leave it
did.
out.
I knew that was coming.
What do you guys think? I mean, I'm going to be honest with you guys. I'll go first. When I look at the befores and afters on Insta,
Yeah.
I'm like, dang, that looks really good. I mean, they do look good right off the bat. I mean, and some of it is like, what do you prefer, right? I mean,
Right.
do you prefer like a more athletic build or a more curvy build or whatever? I do think that a lot of those BBL pics look fantastic. The reason I don't like BBL is because they're dangerous.
Dangerous, right.
And like, there's some long-term problems with them. I actually do like the results like right off the bat. Now, they don't always stay like that, and that's
Right.
another reason I don't like them. But I guess, I don't know. What do you guys think? Have BBLs?
So
No, not the procedure, but like just the look.
Right. I've seen some good ones and I've seen some bad ones.
Yeah.
So I would say yes too. Like I would
Okay.
lean towards the side of yes, but
Yeah.
it can go left really quick.
Okay,
Yeah,
I think
for
that's
sure.
a great answer because all of the downsides of the surgery aside,
Right.
the actual results, I mean,
Absolutely.
they can look really good. I mean,
Absolutely.
Yeah. Yeah. So for me, I think it's overall package, and looking at an overall look of a woman, like, does it fit? Does it not fit?
right? It should be proportionate, right?
Right.
As well as, like,
Yeah.
am I attracted to them? Because for me, looks, we're all getting older, but at the end of the day, like, if you're going to be with them all the time, looks are important. Yes, absolutely.
Right, but I honestly think personality is way more important.
Yeah. At the
Because,
top of the list.
Yeah, it's at the top of the
Absolutely,
list.
but,
women are out there like they're lying, but no, it's true.
No, I mean,
It is so true.
I might not have said that in my 20s or
Right,
as
when
an
you're 20 years old, it's
18-year-old,
different, right? When you're like
yeah,
30s, 40s.
But
Things
truly,
change.
it's
Yeah.
kind of the natural look and feel, and what's the long-term effects there. So I truly don't have any hard fast rules of I will not date somebody
that has
that is
this or
this
that, yeah.
or that, or I
What
like
about
them
they had
all.
elf ears?
Redheads,
Elf ears.
blondes,
What about
all
elf
of them.
ears?
Elf ears is a definite yes.
I mean,
I would absolutely date someone elf ears. That's 100% yes. I would do
Absolutely.
that, and I'm not lying.
because why not? It's a
Why?
good
Yeah, exactly.
conversation. I mean,
Does your girl have elf ears? Yeah, does yours not? I mean, come on.
The Renaissance Fair, I mean, that
Dude,
comes in
you wouldn't even have to
handy.
dress up. It would be,
I
it'd be
know.
excellent.
Yeah.
Absolutely.
All right,
Yeah.
I'm going to do a quick recap. So just now, today, we were talking about men's views on plastic surgery. And first off, women, who cares what men's views are? If you want to have plastic surgery, do it as long as it's safe. But unfortunately, there's some data out there that shows that oftentimes men think less about women who are seeking plastic surgery. I think that's crazy. If you have something you want to do and it's safe, and you can do it, do it. And don't worry what men think about it. These things are for you, not them. And that's really all needs to be said about that. We kind of gave our opinions on stuff, and it doesn't matter. If you want to do something that makes you feel good and it's not hurting anybody, you do it. So that's all I'll recap I have for that one. So.
Absolutely.
All right. I think that's all we have time for today. Robert, high five, buddy. You did good. I appreciate you filling in. Thank you so much.
Real quick, too, Dr. Herman.
Yeah.
Cindy says Nighthawk, he has to be the next guy guest host.
Oh, Nighthawk, okay.
And he said maybe one day.
All right. I have my buddy Nighthawk's going to be on here. That's not his real name, but I might be.
Nice.
But anyway, all right. Well, that's all the time we got for today. We will catch you guys next week. I think Sarah will be back, and we'll talk about some less guy stuff next week on Nip Talk. See ya.